All right, so let's jump into chapter 11 and designing programs and some general principles for designing those programs, specifically around flexibility and low back care. So, number one, there's no doubt about it, stretching, training flexibility is going to improve your flexibility and general joint range of motion, which is going to have, again, massive impacts on your functional movement, on your ability to lift better and stronger, and your overall health and fitness as well as comfort. So it's important, just like with strength and cardiovascular training, with flexibility training, to have individualized programs. So not everybody is going to need to go through the same, standard crossover, reach down to your toes, okay, arm across, stretch your shoulder. These need to be very individualized programs to see improvement and make sure that we're maintaining balance and range of motion across all joints on both sides of the body from head to toe. And then again, just like with strength training, just like with cardiovascular training, use assessments. So both flexibility and lifestyle assessments to identify where the most need is and make sure that as you're going through your program, you're hitting these checkpoints to make sure that your clients are actually improving based on what you've programmed for them and not developing any other imbalances along the way. So again, all of the flexibility exercises need to be joint specific. And if you're noticing a theme here, there's a reason. Just like with cardiovascular and strength training routines, there needs to be an overload here, right? So you need to be stretching these joints beyond what their normal resting length is in order to see improvement. So the SAID principle, right, specific adaptation to implied demands, applies to flexibility trainings as well, or flexibility programs as well here. Now, the one thing I will say is, while we do want to go beyond a normal resting length or into an actual joint stretch, we don't want to go so far that we're going into a painful range of motion, right? So there's joint structures, excuse me, that cause limitations, and there's tissue laxity that causes limitations for a reason. While we do want to increase that range of motion, we don't want to cause any injury or do any harm as a result of our training. So give yourself time. Increasing the length of your tissue or increasing range of motion of a joint takes time. So be sure to build into your program progression and having that overload principle be applied in gradual manners. So there's different ways that you can apply that. Surprise, surprise. Just like with strength and cardiovascular training, you can change the variables, right? So we can change the stretch duration. Maybe we increase the stretch from 30 seconds to 90 seconds, right? We're not necessarily stretching the joint any further. We're just stretching the joint for longer. And then we increase the number of repetitions. Maybe your program calls for stretching each joint for 30 seconds, 3 times each. Well, okay, let's bump that up to 5 times each then, right? These are all ways that we can impact our clients' mobility and flexibility here without going into a painful range of motion here. Now, there's a couple of different stretching methods: ballistic, static, dynamic, and then PNF stretching, or proprioceptive neuromuscular facilitation. And all of these have their own places. They're all very valuable in flexibility programming and flexibility training. So let's look at first active, passive, and active assisted. So active stretching is going to be, again, where your client is actually active in the stretch themselves. They are using their muscles to put themselves into a stretch. So this might be like a sit and reach. A sit and reach is going to be an active stretch, right? They are actually moving themselves into a particular range of motion to stretch a joint. A passive stretch is going to be where they're not using any muscular strength or antagonist muscles at all to stretch a particular joint. This would be like what you see with a pretty normal client physio relationship, right? So maybe up on a stretching table, let's use the example of a hamstring, where you've got the client and you're actually pushing them into a particular range of motion to stretch the hamstring along the back of their leg. That would be passive. They're not actively doing anything to stretch their muscles. And then lastly, active assisted. So this can be something where, let's say, the sit and reach, And maybe we just assist a little bit by applying some extra pressure and allowing them to stretch a little bit further than they would to, or than they would be able to on their own. Maybe we do active assisted for the hamstring again, where we say, hey, brace your core, keep your low back flat against the table, and I want you to raise your leg up as high as you can, stretching the back of your hamstring, keep your leg nice and straight. They get into the full active range of motion that they possibly can, and then we give them just a little bit of assistance there to increase the tissue stretching. So PNF stretching, we've got a couple different variations here too. We've got contract relax or contract relax agonist contract. So contract relax would be, again, let's use the example of a hamstring where we've got our client laying down on the table. I'm stretching them. Maybe I've got their calf up here on my shoulder. I'm bringing them into a comfortable range of motion. I release just a little bit and say, give me some pressure. So I want you to try to bring your heel all the way back down on the table. So they're pushing, creating a significant amount of tension there in that muscle. They relax, and as they relax, I am then now able to push them into a much further range of motion than I was originally, because we've kind of created some neuromuscular facilitation there in order to release some range of motion in the soft tissue. Contract, relax, agonist contract is going to be pretty much the same thing, where we're going contract, relax, and then when they relax, I'm pushing them into a further range of motion, as well as they are pulling into that same range of motion to kind of train that agonist to be able to pull further and further and further. So both great variations on PNF stretching, and PNF is a fantastic way to help stretch into a further range of motion than you normally would be able to reach. Now, we see here just the steps that we just explained. So this is a great resource here for you to kind of screenshot or hold on to if you're going to try this out with your clients here. Now, there are some advantages to PNF stretching. Of course, there's a possibility of it being more effective than static or active stretching, but you have to make sure that you know what you're doing, right? I wouldn't just tell people to partner up, hey, do some PNF stretching over there, without doing any training or understanding what they're actually trying to initiate physiologically. Because if we overstretch our clients at all, we can actually then start to induce some tears, which is going to set our whole program back and limit actually what we're trying to accomplish here. So ballistic stretching is going to be, jerky or bouncing movements. So this is like, you'll see soccer players or basketball players, volleyball players do this a lot, where they're walking up and down the court and swinging their legs up as high as they can. That would be, full on ballistic stretching. And the idea there is, you're really just trying to evoke a stretch reflex, right? So you're wanting to use some of the momentum, and the contraction of your muscles to induce a further stretch than you would be able to normally. And then thereby conditioning your muscles to get used to stretching further than maybe they're used to initially. Now, again, just with PNF, you don't want to program or encourage somebody to do this unless they know what they're doing, they're comfortable with their body, maybe they're a trained individual, or have familiarity in ballistic stretching, as you are increasing your muscle strain, which of course is always going to increase your risk of injury here. Now, static stretching is just that slow, sustained muscle lengthening, right? So static stretching would be like that first example of passive hamstring stretch with a client on their back, right? So it's just a very slow, sustained muscle lengthening as we continue to increase the range of motion little by little by little. Of course, this is going to take much longer, than PNF or ballistic, but is just as, if not more, effective and safe than either of those techniques themselves. So let's take a look at actual program prescription here. So a very, very minimum, we want to be stretching and focusing on stretching 2 days a week. As a trainer myself, if I've got somebody who comes in and they have some significant imbalances, or they want to increase flexibility in a particular range of motion, I'm going to be prescribing to them that they need to be stretching every single day. Now, we know that tissue has laxity, but it also has elasticity, right? So it's going to be able to stretch, but it returns back to where it's comfortable. So unless we're continually conditioning this, it can be lost very, very quickly. When I was playing in college, I had knee surgery, went through physical therapy, and was able to have probably the most range of motion in my hamstrings I've ever had in my entire life, because I was on a very strict flexibility regimen coming off the operation. Now, I didn't stick to that. We got into season, things get busy, and I very, very quickly lost that range of motion. I don't think that that's a unique story to me. I'm pretty sure that everybody has something that's very similar to that. So I would very highly recommend prescribing flexibility training to somebody who wants to see that improvement in their program every single day. Just make sure that while your daily prescription may be aggressive, the intensity of your prescription should be, again, short of pain-free. We don't want anybody hurting themselves or saying this like pain is gain mentality going into this, because you'll just induce some muscle strain, potentially some muscle tears, and set yourself back even further. If you're prescribing flexibility training, it needs to be in either a static or a PNF fashion. I would never prescribe ballistic flexibility training to anybody. That would be more of like probably a warm-up technique than a flexibility prescription. And again, those two types of static stretching are active and passive. Now, you can have them be doing active stretching while they're at home and do the passive stretching with you before or after the session, and the PNF, of course, can be with you as well. So how long should they be stretching? And so how long and how many exercises should they be stretching or using for each muscle group? And you need to be doing more than one exercise per muscle group, right? So this is that, again, SAID principle and overload principle. We need to be coming at the soft tissue and the joint range of motion from multiple ways regularly. So just doing the same exact stretch day after day after day is just going to put you into a rut. You're not really doing your clients any favors and helping them with functional mobility there by just having them do the exact same exercise every day. Each stretch needs to be a minimum, I would say, of 30 seconds. They say 10, depending on the level of flexibility that your client is demonstrating. But again, to really induce any change, this is going to be a long road. And I think anything probably below 20 seconds, you're just kind of pushing that out a little bit further than you need to. And then repetitions 2 to 4, you need to be getting close to a minute total for each exercise for each side. The idea here is that you'll see a gradual progression, a gradual increase in stretch during each repetition. So if you're not seeing any change, maybe change the exercise that you've prescribed, or maybe coach a little bit on the technique, or reassess your own technique. So pre-activity stretching, this is a pretty controversial topic in athletics. Do we need to stretch before we warm up, or can we just warm up our muscles and be done with it? There really isn't any academic evidence about true injury prevention, but it's got a pretty high likelihood of decreasing DOMs. So, as a former athlete myself and somebody who still exercises and experiences DOMs, that is good enough for me to make sure that I'm stretching before I'm increasing activity. Now, one really important note here is to make sure that if you're going to be doing any maximal strength testing with your clients, or you're doing this yourself, or participating in any power or maximum strength exercises, stretching is actually going to decrease that muscle's ability to output a maximal force. So any type of stretching is not recommended before maximal strength exercises. So that's a really important piece there. So I'm going to actually pause this for a second, because we're going to talk very briefly about some low back pain, but I don't want to get into that and then have to cut this video off. So I'm going to stop this here, and video 3 will be about flexibility and low back pain.